morning. It's a big group. I'm gonna give you a little bit of history about myself. I was born in Chicago many years ago. I grew up in Mexico and I went to school in Mexico. I went to Guadalajara University to get my degree as a veterinarian doctor. I moved in 1997, moved back to the United States, and in 2000 I was able to get my accreditation here in the States, and since then I've been practicing. First I worked for Banfield for like 8 months, practice. Then I worked for Dr. Neer, Palmer Ranch Animal Clinic, South Sarasota, and then I was able to open my own practice, and since then I've been around. I'm going to be talking today about feline leukemia and feline AIDS. I want to tell you I'm not an expert talking in front of public. I normally just talk to my staff, but I will try to do my best, and feel free to stop me at any time if you have any questions. I will try to be brief, and let's start. The two of them, the leukemia and AIDS, they belong to the family of the retroviruses, which HIV in humans also belongs to this group. And they are called the silent killer. Why the silent killer? Because they get this disease, and at the beginning, they don't show any symptoms. So it starts slowly affecting them. Both of them, they get different routes of transmission. If we talk about leukemia, they mostly get it from mother to kittens if they share the same bowl of food, water, the litter box, versus FIV, or they will get it when they fight. Okay, I will be talking first about FIV, and this is classified as a lentivirus, which is a slow virus, as I say at the beginning. It starts affecting them little by little. The HIV in humans also belongs to the lentivirus. I'm going to give you a little bit of history about FIV. It was isolated first in 1986 for some researchers in the School of Veterinary Medicine in California. And after they discovered this virus, they had some tissue samples that they collect back in the 60s, and they discovered that the virus exists before in the 60s. So it's as far as they can go to know. This is Gregory. I think this is one of the cats that are here at Cat Depot. And how common it is? It infects cats all over the world. United States is the country that more feline leukemia, feline AIDS cats has, and I want to tell you why. Normally some other countries, they don't test it for AIDS. So that's the reason we have a lot more research. I still go to Mexico. I talk to some of my classmates over there, and they normally don't test for AIDS or leukemia, and there is one very specific reason. It's too expensive. Expensive. Besides affecting cats, it also affects wild felines like tigers, jaguars, leopards, all the feline that are in the wild. It's estimated that in the United States that 1.5 to 3% of the cat population has the virus. And from sick cats, when we get sick cats, it's estimated that every cat that is sick, 15% of them will have the disease, so it's at risk to get the disease. The immune system is suppressed, so every time we get a cat that is sick, the first thing that comes is like, well, let's test it. Let's make sure that we don't have the leukemia or AIDS. How is it spread? As you can see the picture, that's how they, when they fight. It is primarily through bite wounds. It has to be a deep wound for them to get the disease. Non-aggressive contact is not efficient route of spreading the virus. I think this is something very important for you to know, that if they are living together, an FIV positive cat with some other ones, and they don't fight, very unlikely that it will transmit the disease to the other cats through that. On rare occasions, it could be transmitted from mother to kittens. Sexual transmission is uncommon, and the virus has been detected in semen in cats, but we don't have a lot of information about getting sexually transmitted as is in humans, the HIV. How it's not spread? Okay, so it's very rare to see a transmission when they are sharing the food bowls, or if a person is touching one cat and then it goes to the other one, and it's like I say, it has to be a really deep wound for them to get the virus in there. So again, we don't have a strong documentation about if it's spreading through the food bowls or litter boxes or social grooming, so we should not be too overly concerned with this disease if they are together. What do I mean by that? If there's a cat owner that has 3 cats and suddenly one of them is sick, take it to the vet, and they test it and it is AIDS positive, yes, we would recommend to test the other cats. We don't know what the status will be, but that is not to make a decision to get rid of the cat or destroy the cat just because it was AIDS positive. Okay, I mean, if they've been living together, they can keep living together, and I will be talking about what you should do if you have an FIV cat positive. Who is at greatest risk? In fact, any cat is susceptible to the FIV. However, those that go free, roaming free, and cats that are not neutered have a tendency to have a greater risk to acquire the disease. Those that live inside, obviously it's less likely that they will get the disease. Although FIV is a lentivirus very similar to the HIV, it is not contagious to humans. So if you get a cat that is FIV positive, you need to understand that you won't acquire the disease. How is FIV diagnosed? I'm sure everybody is familiar, or most of you, with the regular tests that we run in here and regular clinics. What it does, FIV, we diagnose it through an antibody, okay, not through a virus as is in the leukemia. This test is a combo test that we know, and this side we test for the FIV, and it's checking for some antibodies in the blood. And this one is the leukemia, this that right here, and that is checking from some particles of the virus. So they are different. Let's talk about negative results. When do we get negative results? Let's see. If a cat was in a fight, if it's an outside cat and it was in a fight, let's say today, there is a period that the cat will test negative. For how long? 8 to 12 weeks. Okay, so let's see, if the cat was in a fight 3 days ago, and now it's a big abscess, and it goes to the clinic, yes, the vet wants to know what is the status, if it's FIV or leukemia positive. Now, if it's positive, it's not because that wound right away, it's because it was infected already, right? So it's gonna take, for the test to become positive after the fight, 8 to 12 weeks. Any questions so far with this? Okay. Positive results. The presence of antibodies indicate that the cat is infected with FIV. So if the test that you run in the clinic is positive, it's going to be positive most likely. Most likely, what do I mean? I'm talking about adult cats or cats that are 6 months or older. If the test is positive, it's going to be positive. Kittens that are younger than 6 months, they can have some positive results, okay? But we shouldn't make any decision before the 6 months of age. We need to, let's see, we tested at 8 or 12 weeks of age, and they are positive. We should not make any decision on them until they reach the age of 6 months. It's recommended to retest it every 2 months until they reach that age. If they reach 6 months and they still positive, they are going to be positive the rest of their life. Also, cats that will test positive after they receive a vaccination of FIV. There is a vaccine that is given to cats for FIV. To tell you the truth, I never done any vaccine. I just don't believe in the vaccine. It's been out there for a long time. And what happened is, if you give the vaccine to a cat and you test it after that, it's going to be positive. And then what? Then you don't know if it's going to be because of the vaccine or if it's truly the disease. There are some false positives that we need to be aware of. And they could, I'm going to give you the samples. Kittens that are ingesting the antibodies from a mother's milk, remember, it's not likely that the mother is infected with FIV will transmit the disease to the kittens. It will transmit the antibodies, but not the virus itself. So we should not make any decisions. If we have a kitten that is positive, we should wait until the kitten is 6 months, and then if it's still positive, it will be positive. Then it was the virus transmitted. And the next one, another false positive, cats that they've been previously vaccinated against the FIV. Any questions?
I'm so sorry.
Indications for FIV testing. When cats are sick, we always recommend to do the FIV if we don't know the status of the animal. If it's an animal that it was tested, let's say a year ago, and always been inside, most likely it's going to be negative, but we always want to be sure because we get surprises sometimes. Healthy cats that they never been tested before, we recommend to test them. Newly adopted cats, always is a good idea, especially if you have some other cats at home. You need to test those that are coming, or at least have some documentation from the shelter that you are adopting. Cats that with potential exposure, those cats that normally live outside, they have to be tested every year at least. And if somebody, an owner, decide to vaccinate against the FIV, before giving the vaccine, good idea to do the test. And retest those that are every year, those that are at risk. Key point. Again, with this kitten, I want everybody to understand that if a kitten is FIV positive, you should not make any decisions on the kittens until they reach 6 months of age. I had an experience that was years ago, and this owner, she got 2 kittens, and the 2 of them, they test positive for FIV. I tested when they were 12 weeks. And the owner wanted to make some decisions. Luckily, they were the only 2 cats in that household. So we wait until they turn 8 months of age. The lady, by the way, was living in a boat by Marina Jack, somewhere in there. And at 8 months, they were negative. So they clear up, not the disease, but it was antibodies that they got it from their mother. Some of the symptoms of FIV. Persistent fever, loss of appetite, inflammation of gums. This one is a really big one. When a cat comes to the clinic and it has a bad mouth, the first thing that comes to mind is like, hey, has this cat been tested or not? And if not, let's test it, because it's very typical to see cats that have very infected mouth that are FIV positive. Bladder infections, upper respiratory infections, chronic diarrhea, weight loss, cancer. I forgot to mention something. This virus also like to reproduce in the nerve system, so sometimes we can see some seizures or behavior changes in these cats too. So also when we get some cat that is having seizures, we always like to test and make sure that it's feline FIV negative. Life expectancy. It is hard to predict how long the cat is going to live. I have an experience with a cat, his name was Harley. Before I got my license here, he was discovered he tested positive for FIV in 1998. And then I was in another practice, and then they followed me, and I still see him, and he died in 2008. So he lived 10 years under my care, and yeah, he lived a happy life, and at the end, he died with some cancer. So it was what killed him. But it was like a secondary. So they can live from 10 to 12 years, but also it's common to see cats that only live 2 to 3 years. What about treatment? There is not really a treatment for AIDS, okay? There are some medicines out there, some antivirals that will help to reduce the infection, but it's not going to clear the infection. Care should be taken to prevent some secondary infections, and if they start getting sick, don't delay. Let's take it to the vet right away so they can start addressing the secondary infections that they are getting. A positive FIV cat is less likely to fight an infection than a cat that is a healthy cat. Can we vaccinate FIV cats for other vaccines? Yes, we can. An FIV positive cat should receive routine vaccinations, the core vaccines, which is the distemper or rabies. Okay, so having an FIV doesn't mean that you will not give the vaccines. You can. Remember that they live 10 to 12 years normally after they get the infection. How to manage an FIV cat? Should be confined indoors. We don't want these guys to be spreading the disease out there. Should be a spay and neuter if they are positive. They require a good quality food. Do not feed any uncooked food or any raw meat or eggs. Why? Because they have bacteria. They can develop some secondary infections. Wellness visit to a veterinarian at least every 6 months to see how things going, doing some blood work, physical exam, check for internal parasites. Negative and positive FIV cats can live together in households as long as there is no fighting. Like I said,